myself Sonia Tanuja. I'm MD second year student. I would like to take your blood pressure. Is that okay with you?
Yes.
May I know your name and age? Before getting into the procedure, I would like to ask you a few questions.
Yes.
Okay. Before coming here, have you taken any caffeinated drinks?
No.
Or else you do any heavy exercises?
No.
Are you undergoing any medications?
No.
Okay. Are you a smoker? I will explain the procedure. The procedure is very simple. I just use a scuff on your upper arm. With the help of the bulb, I just inflate it. Okay. Please on here. Just relax. I will roll your sleeves up. If you note in this hand, there is no any fibula or edema or swollen part are noted in this hand. Now I will palpate your brachial. And drain the pulse. Just relax. Is this too tight? I will check your radial pulse. Your radial pulse stop at 120. We will wait for 15 to 30 seconds. With the help of my stethoscope, I just measure your blood pressure. This one. Your blood pressure is 110/70. Thank you for cooperating. Thank you.
Hello, I am Lydia Sinsi. Now I am going to perform eye examination. Make sure that you apply sanitizer before any examination. Now let us move on to the video. Hello,
Hi,
what is your name?
I'm Varshini.
Are you comfortable with this physical examination?
Yes.
Okay, let us start our examination. I'm going to test the visual acuity. For this, I am going to use a Snellen's eye chart. Hold this paper. Do you use any power glasses or reading glasses?
No.
So make sure that the patient is 20 feet away from the Snellen's eye chart. Now hold that card in one eye and read the smallest line possible.
LEFODPCT.
The other eye.
LEFODPCT.
Good. Now I am gonna test the visual field by using the static finger wiggle test. Just look into my eyes without moving your head, and let me know when you can see my finger movements.
Yes. 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 Yes.
Now close one of your eye and let me know when you can see my finger movement.
Yes. Yes.
Now the other eye.
Yes. Yes.
Okay. So now I am gonna inspect the eyebrow. The eyebrows look intact and there are no scaliness. I am inspecting the eyelids. There is no edema and lesions found. The color of the eyelids are normal. And now I am inspecting the lacrimal apparatus, the lacrimal gland and the lacrimal sac. There is no swelling found and there is no excessive tearing or dryness of the eyes. Now I am going to inspect the sclera and the conjunctiva. Please look up, look down. There is no nodule or swelling found. Color looks normal and look right. Now look left. Now I am going to inspect the cornea and the iris for opacities. And also I am inspecting the size, shape and symmetry of the pupil. Now I am gonna examine the direct and consensual light reactions of the eyes. First focus this pen and now see any other distance away from this. Okay. Now I am gonna examine the extraocular muscle movements. Just follow my pen without moving your head. Good. I'm gonna test for any lid lag. So just follow my pen. Now I'm gonna test the convergence of eye. Just follow my pen. So now I am gonna do ophthalmoscopic examination. So this is an ophthalmoscope. Make sure that the room is dark when you do ophthalmoscopic examination. Now I have set the ophthalmoscope to 0 diopter. And now I am going to locate the red reflex and find any opacities that interrupt the red reflex, and also locating the optic disc, retinal vessels, and I am noting the color of the optic disc and size of the center physiologic cup and clarity of the disc margin. And also I am noting the comparative symmetry of the eyes and fundi. And I am also now inspecting the retina, including the arteries and veins. Finally, I am examining the fovea and the surrounding macula.
I am Anusia Ayyappan. I am a second year medical student studying in University of Perpetual Health System, Delta. And let's be hand sanitized first. So what's your name?
Vishalakshi GS.
What's your age?
21.
So today I'm gonna examine your. Is that okay for you?
Yes.
So let's start with anatomy of external ear. This is helix, this is antihelix, entrance to the ear canal, lobule, tragus, and mastoid process. So now I'm going to inspect your auricle. Inspect your auricle for any deformities, skin lesions or lumps. And now I'm going to check for acute otitis externa. So now I'm going to do a tuck test. So now I'm going to firmly press your tragus, and simultaneously I'm going to pull your auricle upside down. Okay, so I will do now. Do you feel any pain?
No.
Okay. If there is a pain, it denotes acute otitis externa. So now we can check for mastoiditis. And now I'm gonna press firmly on the mastoid process. There is no tenderness. If there is a tenderness, it denotes mastoiditis. Now I'm gonna examine the ear canal and eardrum using an otoscope. Use the largest ear speculum so it can be easily inserted into the patient ear canal. And now I'm gonna straighten your eardrum. So for straightening the eardrum, we have to grab the ear auricle and pull it upward and backward simultaneously and slightly away from the head. So note the ear wax or cerumen, any discharge, inflammation, swelling, or any foreign bodies, and note the color and contour of the eardrum, and inspect for the short hand of the malleus, and also note the short process of the malleus. Now I'm gonna repeat same in another ear. Now I'm gonna do auditory acuity test, and do you feel any hearing loss or there is any difficulty in hearing?
Slightly.
Okay, now I'm gonna do whisper voice test. So for whisper voice test, I'm gonna stand 2 feet away behind the patient, and I'm gonna upload the non-test ear with my finger, and I'm gonna gently rub the tragus in circular motion, and I'm gonna say some combination of numbers and letters, and you have to repeat what I say. 2D4.
3U1 2D.
Okay. And I'm gonna repeat same in another ear. One A7.
V2 1A7.
So here the patient says correctly at least for 3 to 4 combination of letters and numbers. If patient fails in whisper voice test, we can go for Weber and Renate test in order to determine any hearing loss. Weber test. I'm gonna do Weber test. For Weber test, make sure the room is quiet. I'm gonna use a tuning fork of 5 Hz, and I would set the tuning fork into vibration, and then I would place the tuning fork, vibrating tuning fork, on the mid forehead of the patient, and I would ask the patient whether she can hear the sound louder in one ear or it's equal in both ears. Now I'm going to perform the test. Do you hear the sound louder in one ear or it's equal in both ears?
Equal in both ears.
Okay. And now I'm going to do Rene test. In Rene test, we're going to compare air conduction and bone conduction. So in Rene test, we have to place a vibrating tuning fork in mastoid process behind the ear, and the patient would say when the sound is no longer here, and after that quickly place the tuning fork near the eardrum and ask the patient whether the vibration is heard now. Now I'm going to perform Rene test.
Hmm.
Do you hear the vibration?
Yes.
From this, we can infer that air conduction is greater than bone conduction, and I'm going to repeat same in another ear.
Hmm.
Do you hear the vibration?
Yes.
Okay. Again, I'm going to say from this we can infer that air conduction is greater than bone conduction, and we have to record your findings.